Basal metabolic rate or BMR. Definition of BMR. Basal metabolic rate is the energy released when the subject is at complete mental and physical rest in a room with comfortable temperature and humidity, awake and sitting in a reclining position 10 or 12 hours after the last meal. It is essentially the minimum energy required to maintain the heart rate, respiration, kidney function, etc. The BMR of an average Indian man is 1750 to 1900 kilocalorie per day. In terms of oxygen consumption, it would amount to about 15 liter per hour. Heavily built persons have higher BMRs, but the BMR per unit body weight is higher in the smaller built individuals. Although the BMR of a man is given above is higher than that of a boy of 15 kg body weight that spends about 80 kilocalorie per day for its basal metabolism. The BMR per kilogram per day of man is about 30 kilocalorie, while that of the boy is about 53 kilocalorie per kilogram per day. The variable that correlates most with the BMR is the surface area of the body. Thus, in case of both boy and man, the BMR is around 1000 kilocalorie per meter square body surface area per day. In case of human beings, body surface area can be calculated by the following formula. Surface area in square meters, body weight in kilogram, and H is equal to height in centimeter. Then factors influencing BMR. There are many factors that affect the BMR. This include body temperature, age, sex, race, emotional state, climate, and circulating levels of hormones like catecholamines or epinephrine and norepinephrine, and those secreted by the thyroid gland. And genetics or race. Some people are born with fast metabolism and some with slower metabolism. Indians and Chinese seem to have a lower BMR than the Europeans. This may be as well as due to dietary differences between these races. Higher BMRs exist in individuals living in tropical climates, for example, Singapore. Men have higher muscle mass and a lower body fat percentage. Thus, men have a higher basal metabolic rate than women. The BMR of females decline more rapidly between the age of 5 and 17 than that of males. And age. BMR reduces with age. It is inversely proportional to age. Children have higher BMR than adults. After 20 years, it drops about 2% per decade. Heavier the weight, the higher the BMR. Metabolic rate of obese women is 25% higher than that of thin women. And body surface area, this is the reflection of the height and weight. The greater the body surface area factor, the higher the BMR. Tall, thin people have higher BMR. When a tall person is compared with a short person of equal weight, then if they both follow a diet calorie control to maintain the weight of the taller person, the shorter person may gain up to 15 pounds in a year. Then body fat percentage. The lower the body fat percentage, the higher the BMR. The lower body fat percentage in the male body is one reason why men generally have a 10 to 15% higher BMR than women. Diet. Starvation or serious abrupt calorie reducing can dramatically reduce BMR by up to 30%. Restriction, low calorie weight loss diets may cause BMR to drop as much as 20%. BMR of strict vegetarians is 11% lower than that of meat eaters. Then body temperature or health. For every increase of 0.5% Celsius in internal temperature of the body, the BMR increase by about 7%. The chemical reaction in the body actually occur more quickly at higher temperature. So a patient with a fever of 42 degrees Celsius, about 4 degrees Celsius above normal, would have an increase of about 50% in BMR. An increase in body temperature as a result of fever increases the BMR by 14 to 15% per degree centigrade, which eventually it is due to the increased rate of metabolic reactions of the body. Then external temperature. Temperature outside the body also affects basal metabolic rate. Exposure to cold temperature causes an increase in the BMR so as to create an extra heat needed to maintain the body's internal temperature. A short exposure to hot temperature has little effect on the body's metabolism as it is compensated mainly by increased heat loss. But prolonged exposure to heat can raise BMR. Then glands. Thyroxine is a key BMR regulator which speeds up the metabolic activity of the body. The more thyroxine produced, the higher the BMR. If too much thyroxine is produced, thyrotoxicosis BMR can actually double. If too little thyroxine is produced, myxoedema BMR may shrink to 30 to 40% of normal rate. Like thyroxine, adrenaline also increases the BMR but to lesser extent. Anxiety and tension may not show on the face, but they do produce an increased tensing of the muscle and release of norepinephrine, even though the subject is seemingly quiet. Both these factors tend to decrease the metabolic rate. Then exercise, physical exercise, not only influence body weight by burning calories, it also helps raise the BMR by building extra lean tissue. Lean tissue is more metabolically demanding than fat tissue, so more calories are burnt even when sleeping. In pregnancy, the BMR is not changed during pregnancy. The high value of BMR in late pregnancy is due to the BMR of the fetus. And significance of BMR. The determination of BMR is the principal guide for diagnosis and treatment of thyroid disorders. If BMR is less than 10% of the normal, it indicates moderate hypothyroidism. In severe hypothyroidism, the BMR may be decreased to 40 to 50% below normal. BMR aids to know the total amount of food or calories required to maintain body weight. The BMR is low in starvation, undernutrition, hypothalamic disorders, Addison's disease, and lipoid nephrosis. The BMR is above normal in fever, diabetes insipidus, leukemia, and polycythemia. Once again, the determination of BMR is a principal guide for diagnosis and treatment of thyroid disorders. If BMR is less than 10% of the normal, it indicates moderate hypothyroidism. In severe hypothyroidism, the BMR may be decreased to 40 to 50% below normal. BMR aids to know the total amount of food or calories required to maintain body weight. The BMR is low in starvation, undernutrition, hypothalamic disorders, Addison's disease, and lipid nephrosis. BMR is above normal in fever, diabetes insipidus, leukemia, and polycythemia.